So the first thing is, very shortly after he was confirmed, the Secretary of State, Rubio, said, we're in a multipolar world now. And so since World War II, the United States has basically been leading a global dollar system. And certainly since the wall came down, they've been pushing to make that dollar system the leader in a unipolar world. And that model has failed. And now they have to adjust to a multipolar world where they can't necessarily dictate to China and Russia and the BRIC nations as easily as they have before. And so the US has an enormous challenge, which is you have been running a global model. You've been using a very expensive military to run that global model. And now the revenues that you're getting from the model don't cover your military expenses and the subsidy you've been paying the population to get them to go along with you, right? So you've been buying people into your democracy. So now the question is, how are you going to re-engineer the model? You've got to get revenues up and expenses down. And what you see the new administration trying to do is, how are we going to adjust the model? How are we going to get more resilience at home? How are we going to do more for ourselves, in North America instead of outsourcing everything? Because you've got a trade deficit of $1 trillion plus, and it's really biting. So, and that's part of the focus of getting current expenditures down. Now, if you look at where current expenditures are exploding, believe it or not, they're exploding in healthcare. So the healthcare budget is now more than double military expenses, because essentially, whether you talk about food or big pharma or global spraying or all the things they've been doing, Americans are poisoned, and the disability numbers are off the charts. Dr. Mark Skidmore just finished a study and concluded that if we could return to 2010 levels of disability, we could drop the healthcare expenses $500 billion.